As you heard, I'm the Director of Aboriginal Health out at South West Sydney Local Health District. Had the great pleasure of working out there for the last 7 years. For me, it is a real privilege because I grew up in South West Sydney. I spent, all my life in the Bankstown area and over the last few years in Liverpool. So I guess for me, there's a real privilege, but also a real sense of responsibility about making sure I do my job effectively, and that we're really focused on meeting the needs of our communities out in South West Sydney. Look, whenever I talk, I always like to give people a little bit of that cultural context, so you understand a bit about where we're at, where we come from, both in terms of history but also contemporary. So South West Sydney is a unique space in that it covers the boundaries of 3 tribal nations for our Aboriginal people, the Dharawal, Darug and Gundungurra nations. So it was a real melting pot, and you can imagine in traditional times that there were strong connections between these tribal nations, that people met for trade, for exchange of knowledge, and I guess our current contemporary communities reflect that in a bit of a different way, in that we're a melting pot of Aboriginal people from all over New South Wales but all over Australia. That's a lot like a lot of our urban Aboriginal communities today. We've got large populations resettled from all across the country, people looking for opportunities. And while we might have many diverse nations making up our Aboriginal communities, they are cohesive groups, they are communities still. And that's how we work in South West Sydney. We work with the different communities. So we are one of the bigger local health districts in terms of our Aboriginal population. We've got over 17,000 people that reside within our boundaries. So in terms of the metropolitan area, we've got the largest Aboriginal population for local health districts. And we've got big communities at Fairfield, Bankstown, Campbelltown and the Wingecarribee. One of the really strong commitments our local health district has had over the last few years is around building cultural knowledge within our organisation and a bit of an understanding about our history. And we do that through a program called Respecting the Difference, something that all local health districts have to do. I'm sure you guys that are from LHDs here today have heard about it, and they look a little bit different in each LHD. We've actually trained over 10,000 people in our Respecting the Difference program, and we're very proud of that. And one of the things that we have a real focus on is trying to paint that contemporary picture, but also talk a little bit about the history. And part of that history is talking about some of those uncomfortable things that have happened in our past. So depending on where we're delivering the program, so for example in Campbelltown Hospital, which is part of our local health district, we tell a little story about the Appin massacre that happened in the early 1800s, where Aboriginal men, women and children were massacred on the orders of Governor Lachlan Macquarie. And that's just about painting that context about the impacts of colonisation and how that's carried through and that trauma and grief sits with our communities. But then I guess what we try and do is we juxtapose that with the strength and resilience of our communities and tell a little bit of story about where we're at today. And in South West Sydney and all over New South Wales, but I guess I'm talking about from my perspective, we've got some really, really fantastic examples of thriving, vibrant Aboriginal organisations that are set up to meet the healthcare and social needs of our communities, that are now multi-million-dollar businesses, huge enterprises that are really functional and successful. And a couple in our patch, a thorough Aboriginal medical service that deliver a range of primary healthcare services and other services, and Kari Aboriginal Resources Incorporated. You fellas might have seen they're big sponsors on a lot of the footy teams these days for the different Indigenous rounds and things. But they're great examples about the strength and resilience of our communities. I think that's always an important part of the story for us. It's about the impacts of colonisation, but it's also about emphasising the strengths, resilience, and that Aboriginal people here and our communities are still around, strong and vibrant. I guess what I was going to yarn with you guys about was a bit about our journey as a local health district, and what we've done to try and make Aboriginal health a priority and front of mind for our staff and our organisation. Hasn't been an easy journey. And it's been something that we've been working on over the last 7 years, and we're still a long way to go, but we've made some progress. Hopefully most of you guys are aware of this, but there's a long-standing definition developed back in the day by Nacho about Aboriginal health, and it's got that real focus on our holistic, whole-of-life view. And I guess that's the approach that we've taken to our governance and to how we've built Aboriginal health within the organisation. That can be challenging working in a big bureaucracy where we're all siloed into our own specific little departments and we've got our own little focuses. But that's our definition. That's our intention of how we're meant to deliver Aboriginal health service. And I guess that's a challenge for government and different agencies, is how do you actually work towards that? So a little bit about us and where we started. So 7 or so years ago, we weren't in such a great place. So we didn't have an Aboriginal Health unit for a long time. The previous director of Aboriginal Health had left a few years before. So I guess a lot of our systems and processes had fallen into disrepair. Our Aboriginal Health team, so we had 20-odd Aboriginal health workers. They were spread right across the district, located in all sorts of different services, or whether it was hospitals, community health centres, mental health services, drug health services, whatever it might be. They were kind of spread out, one out, not connected, not networked, and really functioning in mainstream services with the idea of it. You place an Aboriginal health worker there, that automatically makes the service culturally safe and responsive. Well, we know that's not how things work. We also had very challenging relationships with our community partners. So our 3 big Aboriginal organisations, the district didn't really have formal agreements or any collaboration with, and that was challenging. And I don't think they regarded us particularly highly. So big job, but I guess for us, the idea was to start from the ground up. And the first thing the organisation did, and I'm really fortunate, and I guess what makes my life a lot easier is that I've got a very supportive chief executive who does prioritise Aboriginal health. So I guess the first thing that she did was she re-established the Aboriginal Health Unit, but she started in a place within the organisation where everybody knew that it was important, so that I had a direct line reporting to the chief executive. So I wasn't hidden down in the bowels of the organisation, somewhere reporting 3 tiers below to someone else, a different director. But the chief executive made a conscious decision to say Aboriginal health is important. The director of Aboriginal health will report directly to me. And that really helped me. I guess that got my foot in the door with all of the other sort of general managers of hospitals and different service directors, and gave me that opportunity to really start some of those difficult conversations. The other big thing, I guess, is we focused on reconnecting our Aboriginal health workers, and even though they worked in different services and parts of the organisation, we brought them back together as a collective and tried to create that sense of team, and give them a voice in terms of service models, give them the opportunity to talk about what was working, what wasn't working. And most of our guys have lived and had long connections in our communities, and bring a wealth of knowledge. So it was about respecting and honouring that within the organisation. So we went about redeveloping a lot of our service models and programs, and I guess a really big thing for us was empowering the Aboriginal health workers and making sure that those roles were honoured and respected for the value that they bring to the organisation. I've been really impressed. I sit on that RDN working group, and I've been really impressed by the number of Aboriginal health worker positions that are now supported as part of the outreach programs, and I think that's a great acknowledgement of how key those roles are to providing services that are culturally safe and appropriate. And then I guess what we've tried to do over time is engender that organisational sort of buy-in around the whole Close the Gap agenda. So once we made a bit of progress internally, we started to develop our service models. We started to get some conversations happening about Aboriginal health and having it as a bit of a priority with our hospitals and our services. We started to venture further afield, and we started to re-engage with our Aboriginal community partner organisations and reset those relationships. And I guess we approached them from a very different perspective. As a mainstream health organisation, as a local health district, our responsibility is to provide good, comprehensive services that meet the health needs of our community. But when you looked at our data, it was very, very clear that we weren't meeting the needs of our Aboriginal communities. And I think it was a bit about our local health district acknowledging that on our own we were never going to be able to do it, and that we had to work with the experts in the field, which are our Aboriginal community partner organisations. So it was a bit of a mind shift for our organisation that we were approaching them as, we actually need these guys. If we want to meet our mandate, if we want to deliver good culturally safe services, then we need to have these guys working closely with us. We need their expertise and advice. So that changed our mindset in the way that we engaged. And one of the other big things we did is we actually set up partnership agreements with real tangible commitments. I'm sure you fellas have all seen those MOUs around the place that kind of say a lot of nothing and that will talk nicely and meet every once in a while and, real good. We actually put things in there like we'll provide, this many specialist services, we'll develop this particular pathway, we guarantee so many kids will have ENT surgery from Tharawal, we will have collaborative paediatric models, we'll create mental health service pathways, we will share our data around hospital presentations and about our service performance. So they were, that was interesting and challenging, but it was a whole different approach to our partnerships and our engagement strategy. And then I guess while we're doing that, I guess internally is we started to build our own governance structure, and we started to set up these things at each of our sort of big services in our hospitals called Aboriginal Health Committees that really brought the general managers and the service directors and the executive to the table with me and my team. And we brought along our frontline Aboriginal liaison officers, our Aboriginal health workers that were working in those services so they could share what was happening on the ground for Aboriginal patients and give those real perspectives. We also brought along our community partners. So as you can imagine, there were lots of challenging conversations at the start, but they were open and honest, and I guess it really helped the executive to see what was working in the system and what wasn't. And then what's fallen out of that over time is a whole heap of work around different service models and approaches to how we do things. The other big thing we do is that we're very open and transparent with our KPI data. So we look at things like, at our committees, like the number of Aboriginal patients that are accessing our health services, the proportion of did not waits and discharge against medical advice from emergency departments, the proportion of Aboriginal patients that are coming back with an unplanned hospital readmission. All really good, strong indicators that give people a bit of a picture about really how culturally safe our services are. So we started in terms of our specific service areas, and then what we've done is we've incrementally worked our way up. And I guess the big thing we did was we set up an Aboriginal Health Committee of the board. So that was with the Chief Executive and our local health district board of directors. That's a committee that meets bi-monthly and basically sets that whole strategic agenda around Aboriginal health. And look, one of the things we really try and harness is that power of data. Like I was talking about a second ago, is the importance of sharing that data and really painting that picture around our service performance and highlighting the gaps and where we're not doing well. So we do a thing called an annual Close the Gap report card that looks at some of our hospital performance, but also looks at things around hospitalisation and the difference between our community and the non-Aboriginal community. So we can clearly see that in southwest Sydney, Aboriginal people access dialysis at 4 or 5 times the rate of non-Aboriginal people, that we're twice as likely to have a mental health hospitalisation and 4 or 5 times as likely to have an endocrine hospitalisation. So it really helped our board understand these are our investment areas and these are the areas that we need to take serious and think about how we provide services. So this is a little picture. I know it's a bit complicated and you can see I'm the king of meetings here. So we've got 1 million committees within our organisation, but this is kind of how we drive our structure so that all parts of the organisation have a focus on Aboriginal health. So each of our hospitals, our primary and community health team, mental health, drug health, we have dedicated Aboriginal health committees that bring the execs of those services together, and then we've got specific service strategies and things that we progress. This little diagram's a bit better in terms of kind of painting a picture of how it flows from the top all the way down. So you see at the top of the diagram there, you'll see that we've got our Aboriginal Health Committee of the board. Then under that, we've got our Aboriginal Health Committee of the hospital. And then underneath that is what you'll see is there's a range of service models that kind of sit under that drive our business. So that little acronym there, ATOC, that's our Aboriginal Transfer of Care program. So at Liverpool and Campbelltown hospitals, we've got a specific program that looks at discharge planning for Aboriginal patients with chronic or complex needs to make sure that they've got a safe transition back into the community, that they're linked to appropriate services. That then feeds into our Aboriginal chronic care team in the community, which is on the left, who do our 48-hour follow-up phone calls and then pick up the clients in the community. They then work really closely with our Aboriginal medical service, Tharawal, and they meet on once a month to do what we call a bit of a shared client review around mental health, chronic disease, and basically the clients that both our services are supporting, how are we working together to better meet their needs. So, I guess worked in Aboriginal health for a little while, and you can often see all these big structures up the top that talk about strategic priorities, but unless you've got tangible actions that really flow through down the system that you can measure and see some outcomes, they don't have the impact that you need. And then the other little nice thing that we've got in southwest Sydney that we've developed over the last few years is a specific partnership with housing. We've got big social housing pockets in southwest Sydney, and lots of our community live in those areas. And as we all know, the significant impact housing has on health for Aboriginal people and all people. So we meet with housing as well once a month to look at our Aboriginal patients that have got housing issues that are actually impacting on their healthcare. So we've got this nice little cycle, I suppose, that brings together our team, our Aboriginal Medical Service partners and other Aboriginal organisation partners, and then also the different sort of social providers like housing and facts. So some of the outcomes for us, so the tangible stuff, I guess, is back in 2012-13 when I first started, we identified that we had about 5,000 Aboriginal patients go through our emergency department. When we looked at that figure a few years later, it actually increased to 8,000. Now that wasn't because all of a sudden we magically had so many more Aboriginal people coming to our health services. It was just that we'd done all this work around making sure that people knew the importance of asking the question around a person's Aboriginality as they came into the service. Hopefully our community started to feel more comfortable about identifying, and our numbers start to get a better reflection of what the true utilisation rates are. Similar story in our inpatient areas. Back in 2012-13 we had 1,700 odd people come through. A few years later we counted it as over 5,000. So significant changes. I've already talked a bit about our cultural awareness training and how many fellows have been through that. There's our little Close the Gap report card, and this is something for us, once again, about being transparent and about sharing our data with our communities and our service partners and celebrating the things we do well, but also being honest about the areas that we need to improve in. So just in terms of some of the outcomes, I guess particularly relevant in this forum is that we've developed a heap of models, both at a hospital level but also in the community, that are specific to Aboriginal health. I talked about our Aboriginal transfer of care model. We've got ENT surgery pathways that we've established. We've also got pathways around outpatient specialist services that are specific to our Aboriginal communities. And we've got a stack of collaborative models. RDN has been really good and provided some funding to support the establishment of some of these models. But I'm also really proud to say that the vast majority of what we do in South West Sydney is stuff that we've actually leveraged through our local health district ourselves. So most of our specialist services are the things the organisation just commit to and free people up to provide in acknowledgement of the priority around Aboriginal health and improving our health outcomes. I'd encourage you all to think about, for anybody that works in a local health district, there's a big organisations, like our organisation's a $1 billion organisation servicing 1 million people. There is scope within the resource allocation that we've got to do things differently, and I think that's a really good test of whether an organisation is committed is not what outside resources it can attract to do things, but what it can also do within its existing capacity. And that's, I guess, the challenge that we've put to the board and executive at South West Sydney. So we've talked a little bit about multidisciplinary paediatric models that we've got with Thurl and Kari, a whole heap of specialists and allied health services from things like psychiatry, geriatrics, speech pathology, occupational therapy, endocrinology, nephrology, you name it. Really pleased. One of the great things for me is that our Aboriginal health team's grown exponentially. So when I started, we had 20 odd Aboriginal health workers. We've now got 50 plus Aboriginal health workers, and we've got probably another 40 odd non-Aboriginal health professionals and clinicians attached to our service. So significant growth, and starting to get a better reflection of the resource we need to really meet the level of health need in our communities. And we've also seen some great improvements across a number of health indicators. So low birth weight babies is one that I'm really pleased to talk about, that we dropped from having 16% of our bubs born with a low birth weight to 8% in the last few years. Significant drops in smoking while in pregnancy, and also great immunisation rates. Our immunisation rates are actually better than the non-Aboriginal community. So for us, I just kind of rattled off there a few of the key things that are, I guess, a bit about the steps in the journey for us. So, the power of data and making Aboriginal health a priority within the organisation, the steps to build that robust governance structure, and to really hold the organisation to account around Aboriginal health has been key. Really partnering with our community, honouring their expertise and what they bring to the table around providing health services. I think the mainstream is finally starting to catch up in terms of their way of thinking around holistic health service models, but that's been the way since State Dot with Aboriginal medical services and Aboriginal health. That work around cultural awareness has been key. And I've got to say, we're only just scraping the surface. So we might have trained 10,000 people, but that's a 2-hour session. So you're really only just starting to get people to kind of open their eyes and realise a little bit there's a hell of a lot more that needs to happen after that. We've grown our workforce. We've developed a whole heap of culturally specific services. I just put in here too the importance of symbolism, and I thought that was key. Like in our area, we've got a heap of hospital redevelopments happening at the moment. And one of the really nice things that Southwest Sydney's committed to is, in all of their redevelopments, is having a bit of a focus around Aboriginal health in a couple of ways. Having dedicated Aboriginal spaces for Aboriginal patients. So that will be patient and family lounge. We've got birthing suites. We've also got palliative care wards, different things, mental health spaces. But in the main areas of each of the hospitals, what we're also doing is we're going to tell a bit of a story about our traditional communities and our contemporary communities, and do that in conjunction with our Aboriginal organisations. So that's front of mind as you come into our spaces and centres, and you'll really see that commitment around Aboriginal health. And I guess we're still on that journey about providing culturally responsive services. That's a way to go for us. There's a lot more that needs to be done in terms of being able to truly say that as a local health district, our services are culturally safe and responsive. We've made good progress. We've got a governance structure. We've got a number of Aboriginal health programs, but we still have multiple challenges across our organisation. That's reflected in our performance in ED, in inpatient areas, and still our patient experience. There's still challenges for us. That's me.